This is Dr. Corey Moss at the Moss Clinic, an associate clinical professor at the University of California, San Francisco, on Looking Your Best. I wanted to get a chance to talk about some areas of special interest to me as a member of the American Society for Regenerative Medicine research on stem cells and platelet-rich plasma, PRP, are areas that are both exciting and overused. They offer great promise, and they've been over-marketed. And it's really an interesting thing with any kind of technology that's new and has many different applications that these sorts of phenomena occur. I think it's unavoidable, and hopefully I can set the record straight in this, because it really is important and an important area of development on the one hand, and on the other hand there are things like stem cell facelift and these other vampire lift that have been I think over marketed in terms of their benefits. And we just want to make sure for patients that there's a really good understanding of what these technologies offer and what the future is, because there's a great future for these technologies. But basically, the premise of this, especially with stem cells, is that adult human adipose tissue has many, which is fat tissue, has many stem cells, and many cells that are progenitor cells or signaling cells. And there's even a movement to move the term from mesenchymal stem cell to messaging or signaling cells. They're still calling them MSCs. The point about these cells, which includes periocytes, which are the little cells that surround blood vessels, all of them send out cytokines or cellular messengers that can turn on cells like fibroblasts, which make collagen, and turn on a lot of the repair mechanisms, and there's a cascade that's involved in wound healing and repair mechanisms that are turned on when these cells are activated. And so if we harvest these cells along with fat, and we take them from one area of the body where we don't need it, which a lot of us have unneeded fat somewhere, and we place them to areas that we can benefit from, especially in areas where there's volume loss. Typically with aging, there's a few areas with this, but if we can transfer them to those areas, then we can get sustained and reproducible improvements in areas where there's volume deficiency or changes in the distribution of the volume, particularly of the face. But this has also been used in breast surgery. The so-called Brazilian butt lift is just a very large volume fat transfer. So it's really in many areas of the body, in wound healing, and even in orthopedic surgery now these things are being used with a lot of benefit. So what we do know is that if we move stem cells that are contained within adipose tissue to another area, that we're doing a lot more than we used to think was happening by just transferring fat. 10 years ago, it was really, all our discussions were, how do you get the fat cells to survive when you're moving them from one area to another? And now we're understanding that the percentage of fat cell survival is not as important as the percentage of those stem cells that are moved along with the fat, thus stimulating renewal, remodeling, new collagen formation, and even changes which have been now published in the overlying skin, improvement in skin quality and texture in areas where there's been stem cell or adipose tissue transfer. So there's a lot of names for that. Fat grafting, fat transfer are two commonly used terms, but you'll also see terms like stem cell transfer or stem cell transplant. And so everyone understands, I think, really important. When we're moving fat, we're not just moving stem cells. We haven't gotten to the level yet where we can sort of filter the material and only have stem cells, or only have the cells that are benefiting, like periocytes, and take out some of the cells that are not so beneficial, like histiocytes or monocytes, which are thought to increase the rate of destruction of fat cells. So we're not at that point yet, but we know that we can move these cells successfully, that they can survive, And again, being used in orthopedic surgery and many spine surgery, many other areas, it's very, very exciting. And I'm very glad to be part of the organization that's really looking at these advances. In the face, there's a couple areas specifically that are profoundly effective by volume loss. The most important one is under the eyes, and this can happen in very young ages. So there's a sort of a V formation, often a dark circle and a V together. And that dark circle is caused by a couple things. One can be bulging of the lower eyelid fat pads, which we've talked about before with lower blepharoplasty. Another is that the malar or cheek fat pad sinks down. And as that malar or cheek fat pad sinks down, there's a relative gap or deficiency in between the fat of the eye and the cheek itself, giving that dark circle or hollow. So that negative midface vector is an important concept that we address very commonly in fat transfer and stem cell transfer. Along with that, we can also enhance the malar eminence, which is a great thing that I do in 95% of my facelifts now. So I'll move the tissue into this midface area, restoring the midface volume, many times in the submalar area. And we're also using it in areas like the jawline and other areas where there are relative small or larger deficiencies. So the history of mesenchymal stem cells, MSCs, which could be called mesenchymal signaling cells, is another word from Arnold Kaplan, one of our really the great leaders in this field, really is an exciting area, one that we're moving forward with, we're doing routinely, and we're every day exploring the options of using them along with other products like platelet-rich plasma, or PRP, which has been around now for about 10 years. And simply put, platelet-rich plasma is just blood that is spun down. Patient's own blood is drawn. It's put in a test tube in a centrifuge, and it's spun so it can rapidly settle. The red and white blood cells go to the bottom because of the centrifugal force. The serum, the straw-colored fluid at the top, is what's left over. That's basically the hematocrit. Usually about 40% of our circulating blood is blood cells, and the other 60% is the straw-colored serum. The straw-colored serum can then be drawn off with a pipette, and it's used in a lot of different ways now. What we do know, where it can be helpful, is as a spray to get hemostasis if we're lifting up skin flaps. Beyond that, its uses topically on the scalp or in injections in certain areas of the skin for hair restoration or for trying to improve the contour of face and facelifts or improve the performance of soft tissue fillers have not been proven in side-by-side studies that have been conducted with PRP on one side along with filler and filler on the other side. There is no difference in performance between the two sides. But that doesn't mean it doesn't work at all, and it doesn't mean that we have the best measuring tools to assess those performance. So I would say that the future of PRP is exciting, not as much as stem cells, because I think we're farther away, but in any given milliliter of blood, there might be as many as 400 or 500 different proteins. And some of those proteins you could theorize would be very helpful to a patient, wound healing and improving, turning on cellular messengers and all that sort of thing. And there are probably another half or third of them that you'd say, gosh, that would cause a lot of inflammation and couldn't possibly help. When we get to the point where we can sort those proteins out with gel electrophoresis or some other relatively simple processes, and we can isolate those proteins that we really want, we're not so far away from doing that. It'll be really exciting. But as long as I think that the most important message is that these are exciting new technologies. We are just scratching the surface of them. Over-promising is a lot of what's happening with the marketing, but I'd rather give an honest assessment. There's really not much downside that we can see so far with PRP, and certainly none with stem cell transfer. And so the use in appropriate situations or conditions is great. We just need to make sure that patients understand what the risks and the benefits and the alternatives are for these procedures. If you have any questions about stem cells or PRP or some of these new technologies, please don't hesitate to write me. You can do that at drmoss.com. You can send pictures or videos of yourself if you want, and by all means, I'm happy to keep those private or public. You just specify in the documentation, and we're trying to get to those every day. This is Dr. Corey Moss on Looking and Being Your Best.